Hello, my name is Darcia, and today I will be teaching John, a 57-year-old patient who has been recently diagnosed with borderline type 2 diabetes. My teaching today will predominantly be from the cognitive domain. My objective is that at the end of this 3 minutes teaching session that John will be recalling obesity as a major factor for type 2 diabetes along with associated changes such as dieting and exercising to prevent symptoms of hyperglycemia. My strategies today include this presentation in addition to a handout prepared for John and the questions periodically. Hello, John. Welcome. Today I have prepared for you this handout, John, and this handout is taken from ADA Type 2 Diabetes and Risk website, and it predominantly has the risk factors, causes, and symptoms of hyperglycemia and treatment modalities such as dieting and exercise. You may read along and follow along with me as this presentation continues. Just before we get started, John, can you tell me what you know about diabetes? Okay, John. Now, diabetes is a disorder of blood sugar levels being greater than 126 milligrams per deciliter, especially if you are symptomatic. Obesity has been isolated as a major risk factor for diabetes, and we can reduce this risk by taking in calories that are lower calories and eating a balanced diet in the right proportions, in addition to regularly exercising. Doing these things will reduce your risk significantly. John, can you identify a cause of type 2 diabetes? You're right, John. Obesity. Obesity is a major cause of type 2 diabetes. Now we're going to turn to recalling ways to reduce the risk associated with diabetes. And significantly, eating foods that are low in calories, that is foods like your fruits and your vegetables, eating less starchy foods and stuff, those will reduce your dietary intake and lower your blood glucose levels. Exercising as well also helps you to burn and lower your blood glucose level, in addition to monitoring your blood glucose regularly. That will basically help you, John, to lower your blood glucose level and henceforth lower the risk of diabetes. Okay, John, can you relate to me the risk and the cause in addition to treatment modalities of diabetes? Essentially, I'm just going to ask you in this exercise that you be the teacher and that I be the student. So can you teach back what you have learned? Well done, John. Bravo. You have been awesome. Now, essentially, the teaching plan from the cognitive domain today reflected goals, and John was able to teach back. John teaching back was an evaluative measure to ascertain his understanding. I am confident that John will be able to enact this learning futuristic. Thank you.